today Dr. Funk's going to talk about dystocia issues, calving problems. She's got ketchup and mustard with her. And so, Dr. Funk, we'll leave it over to you.
Thank you. All right, I appreciate everybody showing up. Last presentation of the day. I know is not at the greatest spot to be in, but we're going to have some good information here. And yeah, my lovely assistant Ketchup there is going to be a demo for us today. So if you want to get dirty, you can. I brought gloves. Enough for everybody. You all can play. Promise. Okay. So when it comes to calving, for those of you that don't know, there are 3 stages of labor. Okay, we do have definitive different diagnoses for each of these. Stage 1 oftentimes goes unnoticed. This is simply dilation of the cervix and the birth canal. Sometimes you see a discharge of a mucus plug. This is when cows get real loose on the back end, right? They start to bounce on that vulva. Cows, it's usually fairly short, oftentimes goes unnoticed, about 2 to 6 hours. Heifers, it will take a little bit longer, and that's completely normal. It's because they haven't been through this process before. Stage 1 ends when her water breaks, okay? So once her water breaks, she is now entering into stage 2, and stage 2 is the delivery of the calf. So this is continuing to stretch and dilate, and that calf being expelled, usually between 30 and 60 minutes. In those old experienced cows, they lay down and pop them out like that. Life is great. However, it does not have to go that quick. Okay, up to 2 to 4 hours is normal. Okay, I have had cows that have gone 12 hours and still had a live calf. This is not something that we need to rush. Okay, so when you see her water break, everybody's like, we got to go, 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 go. We got to get that calf out now. Take a breath. Okay, calm down. Up to 6 hours is completely within normal limits, okay? So we try not to get too ambitious about this, okay? Give her some time, let her dilate, let her work on it, and life will be smooth. And then the 3rd stage, most people forget about, but stage 3 is actually expulsion of the fetal membranes. So this is her passing her placenta. Usually within 8 to 12 hours, okay? That's when it should pass. I do not consider it a retained placenta until it's been in there for 24. Okay? And even at 24, as long as everything looks good and the cow is acting fine, I leave it alone. Okay? If it does not pass in 8 to 12 hours, so when it passes in 8 to 12 hours, what happens is those junctions between the placenta and the uterus kind of interweave like fingers. When it passes at 8 to 12, it means that those junctions opened up like they should and separated, and that placenta slides out. Now, if those junctions don't open up for whatever reason, what eventually has to happen is that placenta has to necrose or die. So that takes time. So if they don't pass in about 8 to 12 hours, they will usually pass at 7 to 10 days. That's how long it takes that placenta to kind of necrose and die and those junctions to pull. Okay? And all of that is normal. Okay? I do not get very upset about cows that retain for 7 to 10 days unless she is acting abnormal. Okay? It can be normal as long as the cervix is open and everything's drained into the outside. Life's good. When the cervix closes and she's not draining anymore, that's when she gets sick, and we got to do something about it. Okay? So, during the active stage of labor, if your cow is having issues, in order to communicate with your vet, you have to understand how that calf is coming out. Okay? And when we talk to our vet students about calvings and dystocias and what's normal and what's abnormal, we refer to the 3 P's. Okay? That is presentation, position, and posture. Okay? Presentation simply means, is that calf forwards or backwards? Forwards is what we prefer, but backwards is just fine as long as the position and posture is right. Okay? We can deliver them backwards. That's completely normal. The position basically means, is that calf right side up or upside down? Okay? Spine of the calf should be towards the spine of the cow, and if it is not, that is abnormal. They do have to be right side up to come out. They do not come out upside down. Okay? So we got to fix that. And then last but not least is posture. Posture is simply where are the head, where are the feet. Okay, so if they're backwards, we need to know if both back feet are extended, if one is retained or 2 retained, if you're only feeling a tail. If it's forwards, how many feet do you feel, how many heads, where's the head at, where are the feet at, okay? So, normally, if they are forwards, we want to see that top picture up there, okay? 2 front feet and a head. That's what we want, that's normal position. However, I will take 2 back feet, okay? That can be normal as well. Backwards is not breech, okay? Breech, just so that you guys are aware, is when we don't have any back feet, right? True breech is when there's a tail only, okay? Backwards is backwards, breech is no feet, okay? So, kind of common positions and common malpositions that we see up top, either they've got one front leg retained or both retained, right? So what are you feeling? Are you feeling a head? Are you feeling 2 feet, 1 feet? Where's it at? Those are fairly easy to reposition as long as you got room in there to maneuver. We can see no head. Either the head can be down and tucked underneath, or it can be back and to the side. Okay, again, depending on how big the cow is and how tight things are on the inside, those can usually be positioned fairly easily, given the right tools. Upside down is where things get complicated. Okay, that usually requires some serious mechanical force, and if you can't flip that thing around, it's got to make another exit. Okay, that's usually out to side. So that's where things usually get complicated. That's usually when the vet needs to be called, when things go upside down. Okay, 4 legs. So essentially that calf is trying to push all 4 legs at your front. That is somewhat easy to correct. You just need to learn how to push the back legs while pulling the front, and then everything straightens out. Down here at the bottom, on your bottom left, that is true breech. Okay, no back feet, only a tail. That is breech. Sometimes we can correct that, sometimes we can't. Okay, it just depends on the space in the cow and the size of the calf, but they can be somewhat difficult. That last picture in the bottom right, that is what we call transverse, meaning we got no legs, we got no head. That is a guaranteed C-section. Okay, I have yet to see anybody figure out how to manipulate a transverse calf up so that you can get them pulled out. Okay, so that's a phone call to your vet when you feel that. Okay. So, a few helpful hints from somebody who has pulled a few calves in her very short career. Step number 1, or tip number 1, is there is no such thing as a lube toxicosis, okay? And lube is your best friend when you're trying to get that calf out. Because the more slick and slippery that is, the less friction we have, the easier it's going to come out. So, usually that means that I'm putting a gallon or more inside that cow before I ever even start, okay? How do I do that? Well, I take my gallon of lube, I grab my trusty stomach pump and my trusty stomach tube and my pocket knife, and I cut the top of that gallon of lube open and drop the stomach tube in, hook up the pump, and put the other end of that tube in the cow, feeding it in as far as I can get, right? Because she will push it from the inside out, so if you can put it as far in as possible, she'll lubricate everything as it comes out. Feed it as far in as possible, and have a trusty assistant pump away, right? At least 1 gallon, at least. So I carry 2 gallons of lube on my truck at all points in time. 2 gallons of lube and then probably a couple of squeeze bottles, because again, there's no such thing as a lube toxicosis. And when all else fails, just add more lube, okay? That can actually help you and get you pretty far. Tip number 2 is keep your tools and your cow clean, okay? Dirt will cause friction, okay? It will also cause infection. So every time we reach in that cow, we are now dragging something in that wasn't normally there. And if we don't want her to be fighting metritis postpartum, we need to be as clean as we possibly can. Okay, so wash the back end of the cow, get that tail tied up and out of the way, right? Either some Chlorohex or some iodine. Wash her back end, keep it as clean as possible, keep your arms as clean as possible, and make sure that your tools are nice and clean when you start. Okay, nice gallon bucket, a little bit of warm soapy water, right? Wash those tools. Make sure that they are not rusted, right? You're not keeping them out in the open. The cleaner you keep those tools, the better they're going to work for you when you need them. Okay. Next one, always half hitch. Okay, so half hitch means that we're getting 2 loops on that calf's leg, because if you only put 1 loop on that leg, all of your pull pressure is going to be focused on that one area. Okay, and you can do this to yourself with your chains at home, right? Put 1 loop on your wrist and pull, and you will realize it will get very snug very quick, right? And it will start to hurt. Then do that half hitch around your hand, keeping your thumb out, because that's like the dew claw of the calf, and then pull on it. And you'll realize how much tension that relieves. If you do not half hitch, the biggest problem we see is pressure necrosis, meaning that chain has crushed the tissue on that calf's leg and has ruined the blood supply to the foot, and the foot is going to fall off. Okay, I cannot fix a crushed blood supply. Can't do it. Okay. The other thing you're going to probably do is break that calf's leg, Okay, you're gonna break that cannon bone in there, and I can cast it, but again, if you've crushed the blood supply that goes with it, by the time I take that cast off, the foot's gonna fall off with it. All right? So, always, always, always ½ inch. And always take the time to stretch the vaginal vault. Okay? So when cows don't dilate, it's usually not an issue with the cervix. It's usually an issue with the vaginal vault. Okay? And the vaginal vault is a very stretchy tissue. It's all soft tissue. The cervix does have cartilage in it, and that does take time to dilate, but the vaginal vault is fairly stretchy. So if you take the time, use lots of lube, and clean about it, stretch that vaginal vault out first. All directions, right? Get both arms in there, use your forearms as leverage, stretch it in every direction possible. Once you get that calf hooked up and you start pulling, take time to stop and get your hands up over that head and really stretch that vaginal vault as that calf's coming out. Because the more you stretch, the less likely she is to tear. And when she tears, she's going to scar back and have more problems the next year. So we try to eliminate or minimize the amount of tearing that we get. Some tearing is normal. Okay? We do get amount of tearing with most of our dystocias, and we can deal with that. We're trying to eliminate those big blowout tears where she's got fat coming out of the side of her vaginal vault. Those aren't good. Okay? So take the time, run your hands up over that head, really stretch out that vaginal vault so that that calf pulls out easier. Okay? Now, last point, I'm not saying it because I am a vet, right? But you need to know when you're in over your head. Okay? There's a lot of things that you guys can do, right? There are certain things that you can't. I have more tools and tricks and knowledge in my truck than you guys do. Okay? That's just the fact of what I do for a living. However, all of those tools and tricks and knowledge are wasted if you don't call me on time. Okay? So that question is like, well, when is enough enough, right? My rule of thumb is either 30 minutes or 3 people. So if you have been working at that dystocia for 30 minutes and you have not made any progress, you're probably not going to make progress doing what you're doing. Okay? Or if you and 2 of your neighbors have been in her already and the 3 of you can't figure out how to get it out, it's probably time to call somebody else. Okay? So the quicker you call the vet, the more likely you are to get a favorable outcome. Okay? So yes, I do want you guys to be able to work on your own and get through these. Okay? That's why I'm going to show you what I'm going to show you today. But there will come a point where you do need to break down and still call the vet, right? I've got fetotomy tools, I've got C-section tools, I've got other ways of getting things out that you guys don't have access to. Okay? So know when enough is enough and when to call in for help. Okay? So that's all my presentation, right? That's all the boring stuff. So with that, I do believe you guys have met my lovely assistant Ketchup, okay? And inside of Ketchup is her beautiful baby we have named Mustard, okay? If you would like to know why they named Ketchup and Mustard, you can come talk to me afterwards. It's an absolutely terrible story, but I will tell you, okay? If you guys actually want to come up and gather around, I don't have any issues. You can kind of gather in and take a peek on the inside here. I get that it's somewhat difficult to see from the back. Okay, we'll get Ketchup's back out of the way. Excuse me. Okay, so as you can see, inside of Ketchup, Mustard is currently in a proper position, okay? So Mustard has got her head and 2 feet up in that pelvic canal, and that's what we want to see, and it's what we want to feel. So if you reach in the back end, right, you immediately should be able to get a hold of 1 foot and 2 foot and feel a nose right behind it, okay? If you do not feel 1 foot and 2 foot and a nose, you either need to feel 1 foot, 2 foot and a tail to know that it's backwards, okay? So I'm going to tell you right now that elbows and hocks feel very much similar when they are inside a slippery cow, okay? So if you think that you have a back leg because, oh, that's a hock, it could very easily be an elbow with a head back. And if you don't bring that head forward first, you're not going to be successful getting that calf out, okay? You're going to blow some stuff apart and you're going to be angry, okay? So head and 2 front feet, okay? The other thing I will tell you, and this is me as a public health veterinarian, do please protect yourselves, okay? There are microbes and bacteria in these cows that are zoonotic that people can get. Staph infections are no joke, okay? They come from the inside of the cow in dirty environments. I have had them. They are not fun. The other thing I will tell you is that if you do this enough, you can develop allergy to blood as well as birthing fluids, and the hives that come from that is not fun either, okay? So I have been exposed to enough of it. I do have an allergy to birthing fluids and blood, and so as a result, every calving, every time, I use gloves, sleeves, and full waterproof coveralls, okay? So it's your guys' choice, however you want to go about it, but I am telling you that please protect yourselves and the health of your animal, okay? So the other thing is that gloves are usually clean and easy to clean up, right? So if you've got your bucket, everything is nice and clean, gloves are clean going in, life is good, okay? So if we know that we've got 2 feet and a head, then we can usually put some chains on and pull, and life is great, okay? So I will tell you that I am a fan of chains over straps. Straps, in my opinion, are very, very difficult to disinfect and clean between calvings. Chains are much easier to keep clean. There are 2 types of chains in the world. There are solid stainless steel and there are chrome-plated. The chrome-plated ones are going to rust out. They're going to flake apart and rust out after about a calving season. They are much cheaper than the stainless steel, but they are going to fall apart quicker, okay? So you'll end up going through probably just as many chrome-plated chains than if you would have just bought one stainless steel to begin with, okay? I keep a couple different lengths on my truck. I keep 2 60s, 60-inch chains, okay? I am, I don't know, about 5'4" on a good day, so yes, the chain is about as tall as I am. Okay, that's to give me plenty of length depending on where I'm trying to go and how I'm trying to loop that chain. The other length that I also prefer is a 30-inch chain, okay? So only half as long. And this is the one I prefer to actually put around heads. So if I'm trying to reposition a head, a little less chain is sometimes in my favor, okay? They do sell them at 24 as well, but I feel like 24 is just real short, okay? So by the time you get yourself in there and the chain in that cow, and if there's any sort of distance between that head and her pelvis, you're gonna be digging pretty deep for that chain, and then you lose your tail, right? And when you lose your tail, that makes for a bad afternoon, trust me, okay? So, couple of 60s, couple of 30s. The other thing that I keep in my calving kit is a set of handles. Not these handles. These handles suck, okay? Just FYI. Jorvet makes a beautiful T-bar handle. It's about a 1-inch pipe with a hook welded to the middle of it. It means that you can get your hand around it, okay, and you don't have to go through the middle. That bar is thicker. It also doesn't cut into your hand. So these are pretty thin on the bottom, and so when you get pull, right, and you put enough tension on it, they kind of cut into your hand. Those T-bar handles are thicker and they don't do that, okay? The other thing is I did practice in some cold climates for a while, and so if you have a client or somebody who is helping you pull and they still want to keep their gloves on, these get difficult if you have any sort of glove on, right, to get in there. Those T-bar handles, there's no little hole to go through. It's just the outside, so they're much easier to grip even if you're wearing gloves, okay? So, but this is the demo equipment. I keep the real equipment in my actual vet truck for when I actually need it. So, which is back in Canyon to make sure that we don't have any issues, right? Something weird's gonna happen and something's gonna calve when it's not supposed to, and then they're gonna get very mad at me. So I leave it there. So these handles are not great. They are cheaper than the T-bar handles, once again, but if you are gonna do any amount of dystocia work, I'm gonna tell you, go ahead and invest in that T-bar handle. It's gonna save your hands a lot. And then the last piece of equipment, the kind of general calf pulling box, is I do keep a head snare, okay? There are occasions when I think a head snare is more useful than a chain. This calf snare actually has a very thick slide on it, and I don't like that thick slide. So there are a couple different companies that make them. Just make sure that you get the thin slide on that, because this can get in your way when you get into tight positions, right? But yes, all of this equipment, if you keep it clean, you keep it dry, it's gonna work for you better, especially the head snare, because what happens is you get afterbirth and everything else kind of down in that slide, and then it doesn't want to slide anymore, and then you can't use it. It's pointless, okay? Now, I do use a head snare sometimes, but I will also use my 30-inch chain as a head snare as well, okay? That's where that short chain comes in, right? If I can't get that head snare on because the calf's in a bad position, that's when I go to the chain and kind of set it like a head snare. And I'll show you guys how I do that, okay? So the other thing is like I said, I did keep 2 gallons of lube with me at all point in time and a couple of these squeeze bottles, okay? Because lube is your friend. It is always your friend. It is never going to make things worse. It is always going to make things better. So lubricate the cow, lubricate your arms. Every time you go in and out, keep things clean, and you're going to reduce friction, and it's going to help you out a lot, okay? So the reason I keep 2 chains of each length is because when I put them on the legs, I do 1 chain per leg, okay? So what that does is it allows you to shimmy those legs independently, okay? So if you have the same chain on both legs, meaning you've got a foot on each end, it gets somewhat hard to try and shimmy those legs, because if you're pulling in the middle, you're going to pull both no matter what. Okay, so I try to keep chains independent on legs. The other part of that is the calf jack that I use, not calf puller, calf jack, that I use is from Stone Manufacturing, and it's the ratcheting one. So it pulls one leg and then the other and then the other and then the other back and forth, and that helps it shimmy. And if you've got 2 chains on that shimmy on that ratchet works better than if you have it on 1 chain. Just a helpful hint, okay? So putting chains on, I always teach my vet students, start with the loop on your hand, okay, up on your fingers. If you put it all the way down on your wrist, it is going to slide as you go into that cow, and then you're not going to have that loop where you need it. So 3 fingers on the inside keeps your loop where it should be, okay? So start with that. Again, plenty of lubrication, and I'm keeping it there as I go into that cow and using my thumb to kind of open that loop as I see fit. And the first thing I'm reaching for is a foot, okay? So I'm going to find the end of that foot, and we're going to slide chain right over it, okay? We need to go above the dew claws on that first loop. So when you're getting in there and you're sliding, make sure that you're sliding all the way up above the dew claw, okay? Then from there, I know that I've got that on. I've got it set up above the dew claw where it should be, right? Nice and snug, because the more snug your chain is, the less likely it is to slip. And if it slips, it can cause damage. So make sure that they are snug. If you think it's tight, go back and tighten it some more to make sure that it's plenty tight, okay? So nice and snug. And then I always do my half hitch outside the cow, because I'm not that coordinated to do it inside the cow, okay? So hand over top, underneath, making sure that the tail comes out on the bottom, okay? And then we bring that loop in, just like we did on the first one. Now here's that part where you got to make sure that you're putting your half hitch on the same leg that you started on, because a half hitch on the other foot isn't going to get you anywhere, right? So follow that chain, figure out where it is, okay? Make sure that you're going back down onto that same foot. And again, work that half hitch loop just like you did that first one. The half hitch is going to be a little bit more difficult because you're sliding chain over chain instead of chain through an eye, okay? But just work it down and make sure that it is nice and snug, okay? And once it is snug, yeah, so this one goes underneath the dew claw, right? So first loop on top of the dew claw, second loop under the dew claw, okay? There's a space between the back of the hoof and the bottom of the dew claw that makes kind of a valley. It sits in there just perfectly, okay? Once you have it on, keep tension, okay? This is where I usually ask for a lovely assistant to hold on to my chain. Thank you.
He was an OBGYN.
Oh, so you know all about chains, right?
No, we didn't use it.
Or was it baling twine, you know? Okay, so I got the first chain set. I'm going to reach for my second chain. I'm going to lubricate my second chain just like I lubricated the first, and we're going to start the process over again, right? So we're going to make our loop, okay, on the hand, into the cow, and we're going to make sure that we're going on that other foot, okay? So I know where that other chain is, get that out of the way, and then we're going to slide on to that other foot, okay? So I am 5'4" on a good day. I wear a size small glove. Some days that is my best friend. Some days that is my worst enemy, okay? okay? When I'm working dystocias on a tiny little feeder heifer, it's my best friend, okay? Because I can get both hands inside a heifer that most guys can't, right? However, when I am trying to dig a head up from inside a Holstein cow, my short little arms oftentimes aren't long enough, okay? So, doesn't mean I can't get it done. It just means that I go about it in a slightly different way than, say, my long-armed counterparts, okay? So, second chain on, again, above the dew claw, nice and snug, half hitch outside the cow, follow that loop in, maintaining tension on your tail, right? And if you keep kind of pulling on that tail as you set that loop, it's going to set down nice and tight for you, okay? Now, when you set your chains, some vets will tell you that they want their chain, that link of chain between your first loop and your second loop, to run down the outside of the leg. I don't care if it's outside or inside, as long as it's on the side. On the top or on underneath can create some problems, but if it's running down the side, it's going to be in the right spot, okay? So, once you've got both chains on, then you grab your handles or your calf jack, however you see fit, okay? And you start to pull. Now, when you pull, okay, you're also going to make sure that head is coming with, okay? So, that's why I have used calf jacks a lot in my career, because I've done a lot of dystocias by myself, okay? Because I worked for a fairly large dairy, and they call you at 3 a.m. and say, hey, she's in the stall, you go fix it. So you go out there at 3 a.m. and you do it by yourself, right? So, this is a point where I would hook up the calf jack and put a little tension on it to bring it out close to me, and then once that tension is there, I'm going to reach back in and make sure that head is following, okay? Make sure that you can get all the way around it, that the ears are coming up, and then again, you're going to pull and make sure that everything's coming with, right? So, when you pull, the thing to remember is that she's probably still having contractions. And so in order to be as efficient as we can, you need to pull when she pushes and rest and maintain tension when she rests, okay? Don't let it sink back in, okay? Just maintain that tension and keep it where it's at until she decides to bear down and push again. And then when she pushes, you pull, okay? And then once that push is over, check, make sure everything is positioned where it should be, head is coming, feet are where they should be, right? You got the right chain on the right side and the left chain on the left side. Crossing legs can be a bit of a problem, okay? Make sure the legs are straight. And then as you continue to pull, okay, always checking that nose, because the nose will catch on the vaginal vault. So check that nose, make sure that it's laying down where it should. Keep pulling. So, as we get out to about here, we don't continue to go straight out. This is where we come out and down, okay? Because that's the natural arch that that cow would calve in, okay? So we're going to come out, and then we're going to come down, okay? And you can see it on this calf that he's starting to get stuck on this vaginal vault. This is where you need to run that hand in there and set it up, right? Give it a little stretch, pop the ears out, okay? And now out and down, baby's out, okay? So, that's the easy one, okay? That's a nice easy pull. Get the chains off, okay? The other part of this is neonatal care. So immediately after we pull, what are we going to do, right? We're going to rub it, stimulate it on the chest, clean the nose, each nostril, clean the mouth, okay? If you've got some straw up the nose to stimulate the sneeze, okay? Rub the chest, rub the abdomen, okay? They will have fluid in their lungs when they come out. Forwards, backwards, doesn't matter. They will all have fluid in their lungs. That fluid is normal, okay? That calf does not need to be picked up and swung by his back legs to get that out. Just FYI, okay? Now, that fluid will get absorbed by the lung tissue, usually within 24 to 48 hours, okay? That's normally how it occurs. If the calf does appear to be having respiratory issues, we put them in the resuscitation pose, okay? Resuscitation pose is sternal with both back legs forwards, okay? That is resuscitation pose, okay? That gives that calf's lung all the space it needs to expand, and it can breathe as easy as anywhere else, okay? Again, don't need to pick them up by the back legs, swim around. Resuscitation pose, keep doing that stimulation, right, on the chest, on the head, on the hip, right, to get them stimulated to breathe and start working on their own, okay? Normal healthy calf should be up in nursing within 2 hours, okay? Colostrum absorption and colostrum quality both start to deplete by 4 hours of age. So, if you wait until after 4 hours, that calf's going to get less and less and less antibody. Okay? And that antibody that they're getting from mama is what's going to last them through the first 4 months of life. Okay? Right. And so that's what we call gut closure. So it's the stomach and it's the small intestine. And so that gut closure starts at about 4 hours after birth. So if we can get colostrum in them before 4 hours, they're going to absorb more of it, okay? And also the quality of her colostrum in her bag will start to decrease at 4 hours, okay? Okay. Questions about that normal calving process? Those are the easy ones.
This starts after you wait 12 hours or so.
So 4 to 6 is what we see in cows. It can be 12 to 18 in heifers. So once her bag has broken and you've seen that water, usually you may not see the water break, but you do see those membranes hanging out. That means that she is in active labor. Okay? And that usually, if I know that she's been in active labor, I give her at least 30 to 45 minutes just to see what she's doing, see how she's acting, right? Because I may not necessarily know exactly when she started, but I need to gauge where she's at and how much progress she's making, okay?
Why don't you see them come out and
Right.
come out?
Yep, and I know, and that's like, you want to jump in there and just like grab those feet and pull it out, but that's normal, okay? Especially in heifers and younger cows, it's them pushing and trying to stretch, and then when that contraction goes away, it kind of sinks back in. And the next contraction comes along and they push and stretch, and then things come back in, okay? And that can take a couple hours.
Now with the cow standing or laying down?
Not really. No. So it depends on wherever that cow is comfortable. Okay? So if she is already laying down and she doesn't want to get back up, I will get down in the straw and do all of this with her laying down. I do know practitioners that love to pull all of their calves laying down, like to the point that they will cast the cow down every time they start a dystocia. If she's going to stand for me nice and be cooperative, I'll let her continue to stand. Okay? But if she's down and she wants to lay down, I get down in the straw with her. It's whatever makes her comfortable.
How long do you wait for nursing to occur before you jump in? 4 hours is the antibodies don't get into the intestine. You go an hour, 2 hours, feeding tube.
Right. So dairies will tube feed the second that they get the calf out, right? And it's because they have colostrum banked, and so as soon as that calf hits the ground, they thaw the colostrum and they tube it to make sure that calf gets enough. We are not usually tubing the colostrum because that cow should have the best quality colostrum for that calf, and so I really do want to see them nurse rather than tube. I usually give it an hour or two, make sure that calf is up and kind of being vigorous. If they're a little slow and kind of dumpy, then I try to help that calf up. Maybe that's when we put the cow in the chute, lead the calf, right? See if the calf nurses first. I always give the calf plenty of time to nurse off the cow before I try to offer a bottle, because they will want the cow's to eat before they want a bottle, and then if they refuse the bottle, then we go to a tube to make sure that I'm getting colostrum in is when we can. So gut closure starts in 4 hours. It is not complete until about 24 hours. So we do still have time after that 4 hours where we are going to get some absorption. It's not going to be as much, but we still get absorption. It just gets less and less and less the longer we wait. So ideally, if we know when that calf was born, within 4 hours, I would like to see colostrum in the belly. However it is that we got it there, whether we got that calf up and nursed or we milked the cow and tubed it to colostrum. But if we don't know it's been 4 hours, give the calf time to try and do its thing. All right?
Mama turned around and you starts licking and sit back and go visit.
Yep. Right. So if she wants her calf, Give her calf and give her space, right? Because mama licking and stimulating that calf is so much better than us doing it, okay? Because the other thing is that cow, she's got microbes and bugs in her mouth that calf is going to need to actually build a healthy rumen, right? And so she's now passing her flora onto her calf, and that's how she does it, is by licking her baby. And we get in the middle of that sometimes because we think we know what's better, right? But if that cow wants her calf, let her have it, right? And that's true, like when I do C-sections, as soon as I get that calf out and on the ground and I know that it's breathing, I drag it to the front of that cow and let her lick on it while I sew her up, right? And then that way, as soon as I'm done sewing her up, I hit her with her post-op antibiotics, a little bit of pain management, and she's already bonded with her calf at that point, and calf's ready to nurse.
You're always supposed to wait till we weigh and tag.
You can do that kind of whenever, right? But realize that when you start messing with the calf, mama might get a little irritated. So I try to give them enough time that the calf can nurse and mama bonds, and then do it after they get colostrum. Yeah, till they're dry, they've had some colostrum, because that's the hurdle that we don't want to slow up, is that colostrum intake. Yeah.
How does it intervene with the tube feeding? What's the minimum, maximum of feed?
Right, so colostrum, when we look at colostrum management, we look at the 3 Qs, right? And this is big in the dairy industry, but it also applies to beef, right? We look at quality, quantity, and quickly, right? So beef cows are going to have a higher quality colostrum than any dairy cow, right? It's a dilution factor. That dairy cow just makes so much that the antibodies get diluted. Beef cows don't make as much milk, so it's higher concentration. So a beef calf does not need the 4 liters or the gallon that the dairies are tubing their calves. Usually I milk out that cow until I've got what she's giving, and then that's the amount that goes in the calf, because that's what the calf would have gotten anyway, right? Now, if you're using colostrum replacer, that becomes a different story. And if it's store-bought or borrowed from a neighbor or harvested from another cow, all those are different stories. But usually, it's whatever I get out of that cow, that's what goes into that calf.
I just never had any problem overfeeding them. Some people say that you can't overfeed them. And I thought this would be down 2 cans.
Right. So, I mean, the problem with overfeeding is that sometimes we can get sloshy guts, but usually that colostrum feeding, we're not too worried about overdoing it, because we need that amount of colostrum in there for them to absorb it. Now, if we're dealing with like a scour calf, we can very much overload that gut, right? Because their gut isn't functioning like it normally should, and as a result, it doesn't pass as quickly, and then we end up with abnormal bacterial growth in the abomasum, and then we end up with other problems. But as far as colostrum goes, usually not. Right? Tube them until you can kind of feel that that belly is full, because you can feel their abomasum, you can feel how full it is. Okay? Don't try to overbloat them like a tick, but usually whatever that cow has to offer is what that calf gets. Any other questions? Great questions. Okay. So, that was the normal one. That's the easy one. Those are all easy ones. Okay? So, we'll take it up a notch. Okay, so Mustard here actually has all the joints that a calf should, and you can hear that she's leaking air. It's because she has a chest cavity, and so we can actually do resuscitation, and she does have a throat, so we can practice tube feeding. All that's for our vet students that we use her for. So we'll put her back in. Okay, she is magically rebred, look at that, and ready to calve again. Okay, so, she's good age? Yeah, she's really calm, nice, well-mannered, yeah. She's even still got a good udder on her, which is quite uncommon for a Hereford. Sorry, there aren't any Hereford people in here, are there? Sorry, probably should have checked on that one first. So, so common one that we run into is that leg back, okay? So, depending on where that leg is, depends on what we need to do to get it to come forward, okay? So, when you reach in the back end of her, this time, we are going to feel 1 foot and a nose and not a second foot, which means we need to go dig in for said second foot, right? So, there's a couple of tricks to getting that foot forward, depending on where it is and how it's positioned. The other thing I normally do is that I actually wear like a latex or a nitrile glove over top of your OB sleeve so that it keeps all that excess kind of glove and sleeve on your hand. However, I forgot my gloves in my truck and then they valet parked my truck and I can't get my gloves. So we're doing it OB sleeves only today. So yes, it looks a little awkward. So, okay, so we reach in this time, we feel nose, we feel foot, not other foot. Okay? So, depending on how long your arm is and where that foot is at, if you can reach in there, follow that leg back, and feel where that foot is, right? Pull it forward at the joint, okay? And then if you can, get a hand on the edge of that foot. Because those toes are sharp. They may not seem like it when that calf comes out, but they will go through the side of a uterus real quick. Okay? So, if you can get a hand on the end of that foot and bring it towards the center of that calf and forward, that's the way that leg wants to bend. Okay? So, if the leg is back and to the side, hand on that foot, bring it to the center of that calf's body and forward and up. Okay? Trying to bring it along the outside, that's not the way their shoulder moves. Okay? It's going to be more resistance if you're trying to go to the outside. So, tuck it to the inside, bring it up underneath that chest, and forward, okay? But the big thing is make sure that you get a hand on the end of those toes. Because if you've only got a hand on that cannon bone, and you're dragging it right up the side of the uterus, that's how you put a big old hole in the side of it, okay? So, get a hand on those toes, bring it forward, and now you got a normal position calf, right? I usually don't walk away from them. Once I reposition, I go ahead and pull, okay? Mostly because as a veterinarian, I don't want to have to come back out, okay? Now, if she's your cow and you know that she just started and you reposition and you want to leave her alone for a couple hours and see what she does on her own, it's entirely your decision. But yeah, especially if she's been working at it for a while, they get tired, and so at that point, just go ahead and pull, get the calf out, okay?
Where's that nerve that gets pinched in the cows? That's too long.
Right. So it's the obturator nerve is what he's talking about, where that nerve is being pinched when the cow takes too long to calve. And that runs along the inside of the pelvis, kind of on the inside here and here. And that controls the muscles on the inside of her legs. And so if she doesn't have control of the muscles on the inside of her legs, she doesn't keep them up, and then she splays out, and then she goes down, right? She can't bring those legs back together to stand up. So it's when that calf gets pinched up, usually right on that bony pelvis, right in here, that's when they're going to pinch that nerve. So if you got a calf that's up and jammed in there, we need to make a decision about what we're going to do with that calf fairly quickly to reduce the amount of damage that we're going to cause to that cow. Because the longer that calf is up in there and the longer it's pushing on there, the harder it is for us to get that swelling back down and get that cow back up. Okay?
Generally, when that happens, how long does it take before they try to get back? Because I've had them go down and stay.
Right.
We waited a week to go ahead and shoot.
Right. So, question about how long it takes them to come back up after they've been down. The real question is how bad is the nerve damage? Okay, so if the nerve damage isn't really damaged, it's just compression from swelling in the pelvis, we can do quite a bit to get that swelling down. Okay. Once she gets the calf out, we usually load her up on steroids. Steroids do a remarkable job of taking swelling out. And if those steroids take that swelling down enough, it takes compression off that nerve, she should be up probably within 24 to 48 hours. Okay? Right. The IV that we usually try is a calcium or calcium complex. CMPK is the common one. It's got multiple electrolytes in it. It's good for pretty much all of those down cow syndromes, like milk fever and grass tetany and all of that other stuff that goes along with it. So yes, you can try that, but usually if it's truly nerve damage, we got to get the compression off that nerve. My rule with down cows is I give them 24 hours. If they aren't making progress, at least making progress, now she may not be up in 24 hours, but if she's not making progress in 24 hours, she's probably not going to make progress. So yes, you can keep them from falling over. The other thing is that they do need to be turned and moved. So these animals are not designed to lay down on their side for extended periods of time. They're very heavy. And so when they get down and they stay down, that creates what we call pressure necrosis, when laying on one hip, and that creates a whole nother hurdle that we got to get over, right? So if she is down and you're trying to nurse her back up, she does need to be moved from hip to hip about every 8 hours.
And the gas.
Correct. If she is not up in sternal, then she may not be eructating, and then she can bloat. And when she bloats, that's usually what kills them, right? That's what usually gets to them when they go down flat out on their side, is they stop eructating and they just bloat and die at that point.
You wouldn't hoist it up with the trap pins and...
Like the hip lifters?
Yeah.
So the question is that do I use the hip lifters? I do try. Okay, but usually if you have to hoist her up, if you can get her up, she'll stay up for a little while, but then they immediately go back down, and then you're back to hip lifting her every time you want her to get back up. So eventually we can do it a couple times and see if getting her up in a proper position helps relieve some of the pressure on that nerve, right? Relieves that swelling, and if it does, then she stays up and she can get up and down on her own. The problem is that when it doesn't, she goes back down, and now we're hip lifting her every time to try and get her back up, right? The other thing about down cow is that you cannot salvage her, right? So if you are hip lifting her, you cannot put her on the coal truck. And so we try to at least get her to a point that she can get up and stay up and stand on her own, so we can at least get her on a coal truck and salvage her.
What if one foot is behind the head? Front foot.
Front foot behind the head, okay?
I've had it happen twice.
Right. So you're talking something like that?
Yes, where the nose and one foot come out, but the other one is completely...
Kind of back behind. So if it's tucked up there, you kind of got to look for path of least resistance, right? So we're hitting foot and nose. You got to find where that other foot is. And if it's on top, the other thing is you got to know which is right and which is left, so you know which direction to pull. Because trying to take a right foot down the left side doesn't work. I'll tell you that much. Okay? So once you figure out which is right and which is left, then you're going to slide across that head and pull forward, right? Because the biggest thing with those is usually that they get some sort of elbow lock, meaning that elbow doesn't come through the pelvis. And to relieve that, we need to get that arm stretched straight forward. Okay? Because that's the other thing that can happen when they're coming forwards, is that if their front legs are tucked underneath the chin and their elbows are tucked, they will get locked at that pelvis. So at that point, you got to catch those legs straight out, straighten them first, and then pull and make sure everything comes with it. Okay? Okay. So the other kind of major position or malposition is the good old-fashioned head back, right? Either head down in between those legs or straight back into the side. Kind of either way, it's finding the path of least resistance, okay? So this is the case where, depending on how that calf is positioned, I may either reach for a head snare or my short chain, okay? So first of all, I'm going to reach in, I'm going to try to evaluate, okay? I got to know where my feet are. Where's my head? Okay, it's going straight down. So if I think that I can get that head snare on, I will reach for head snare. But the problem is that when you go in with head snare, you got to be able to get behind both ears. So if that head is back into the side and I can't hit that far ear, my head snare isn't going to do me any good, right? So that's when I go for what I call the Wiley War Bridle, okay? Named after Dr. Caitlin Wiley. She was my resident maid at Iowa State. She didn't like head snares, hated them. She was a theriogenologist resident, pulled calves all day, every day, hated head snares. Her preference was to use a short chain, okay? So when we do that, it means that we can keep that chain open, loops open, and what I can do is I can find that neck, okay? I know the ears are there, right? And so what I'm doing is is I'm going to take that chain and I'm going to go over the neck, right? Pass it over top of that neck, preferably behind the ear, okay? And catch it when it goes down the bottom on the other side, okay? Now, this is also, again, where you have to make sure that you've got plenty of lubrication and arm length, okay? So, pass it on one side, and then come back up the other side. Yep. So you're there.
What was that you said about arm length?
Right. So this is problem number 1 that I have. Okay. I do, right? Not yet. Give it time. Right? So once you get on the other side of that neck, right, then you can bring it back around. And this is where being small comes in handy, because I can get both ends inside that cow and cinch it down, right? So if I am around her neck, around the calf's neck, the next step is I take that chain and I slide it down into the mouth. Just like that.
That way you're not choking the mouth.
So that's the way the head snare sits, right? You got to get the cables behind the ears, and that slide goes in the mouth. So I'm doing the same thing, but with a chain, okay? Now, this works really great for those head back and to the side, because a lot of times I can't hit that far ear, but I know where the neck is. And I can pass that chain around the neck, and once I get around the neck, then a lot of times I actually come up from the bottom and work it into the bottom jaw. And then once it's in the jaw, now you've got that head on a fishing line, right? And you can get your handle on there, feel where it's at, and then pull it so that everything comes forward, okay?
So you got one hand pulling, one hand.
Right. So typically, especially if that head is back into the side, I've got one hand pulling and one hand reaching for the nose. So if I can, as soon as I can get on that nose, I can pull the nose and the chain. It gives me enough leverage to come forward. So the beautiful thing about Ketchup here, she's nice and open, right? Plenty of room, and then some. The problem you run into, especially when cows dry out, is that if that calf dies and that hair is dry and the inside of that cow is dried out because she's pushed all of her fluids out, that's where that gallon of lube comes into play, okay? Before I even try to snake that chain on, I start with a gallon of lube, okay? Put some lubrication back in there, try to make sure that everything's gonna go smooth and move when I start to push on it, and then I pass the chain and I set it, and then once I set it, I may put some more lube back in there, right? Make sure that the chain is nice and lubricated, and then try to get your hand between the head and the wall of that uterus to bring that nose around and forward, okay? Okay, questions?
So after you got that chain through the mouth on the other side, you then take that end loop or put that through the end loop, so you wind up with one chain? How do you choke it?
It's like a loop.
Yeah. Could you pull that little mustard and put it on?
Yep.
Yeah.
Well, I see.
Pull the mustard and see what it looks like. So this is where we end up, okay? So when I went in, chain was open,
Right.
okay? And I went, depending on how that neck is fastened, we go over top and then catch it underneath and come back the other side, okay? And so at that point, you pull it just enough so that you can get your tail back through that.
Oh, that's like,
Right? So now you've got the neck on,
right.
okay? And depending on where your chain is at, if it's underneath like it is here, all you got to do is snake that chain right into the mouth and tension on the tail, and it slides right down into the mouth. And now you've got that head on a snare. Okay? So,
Have you ever tried a situation where you've had to chain the calves' front legs as well as the head. Simultaneously.
Yep, so especially on a lot of those narrow pelvises, so the question is that do we ever put chains on both legs and the head at the same time? Yes, especially on that narrow pelvis. So that's actually an indicator that the pelvis isn't wide enough, is that when you hook up those feet and that head wants to go back, it's an indicator that the pelvis isn't wide enough. So you either need to go in and try and dilate more, or if it's getting snagged on the bony pelvis, it's probably not going to come out that direction. Okay, so, but yes, there are cases where we do get chains on both front legs and the head to make sure that everything's going to come out nice and smooth and in the position. Because a lot of times the head wants to like flop to the side. And so if you put a chain or a head snare on at that point, it keeps it in between those front feet, which is where it needs to be to come out.
You gotta use more than 2 chains, I just call it that.
That's why I carry 4 in my truck, right? So, one more time. So, we're going to go in, we're going to find out where that neck is, we're going to pass the chain on one side, and then we're going to go underneath and find that loop, and bring it back. Okay, and then once we get enough loop that we can find it on the other side, we're just going to drop that end in, and now we've got our loop. Okay, you can cinch on that a little bit. Right? If I truly want to position that head, I need better control of that lower jaw. So that's when you give it just a little bit of slack and you feed it up into the mouth.
Otherwise, you choke it.
Right.
Okay.
And gives you better leverage because it's not this part of the calf that I'm trying to move, it's this part. Okay? And that's where my pivot is. And if I've got a chain on the end of it, then it's going to pivot better for me. Okay? It gives me more leverage and it gives me more pull to come out to the back. Okay? I do the same thing with feet, right? So when my arm is not long enough to get to that foot to reposition, I get a chain on what I can, right? So I feed that chain usually around what I can feel. So over the top of the leg and back underneath, and create that loop inside that cow and cinch, and then just work that chain as far down as I can, right? Over each joint, and then cinch it a little bit tighter, and then use that for my leverage to pick a leg up to come back at me so that I can get back in there, move it down to the next joint, pick it up, and bring it back towards me, okay? Because if you don't get a hand on the end of that foot, what you really need is a chain above that dew claw so that you can pull it up towards you, and then you can get your hand on it, and you've got twice as much pull when you're pulling chain and foot at the same time. Make sense?
How quickly are you supposed to be doing all this?
So it depends, right? And so this, right, so it depends on how long she's already been working at it, right? So did you see her water break or not? And we're guessing. The biggest question that most clients ask me when I show up is the calf still alive? Well, I don't know, okay? There are some indicators that can help me say that maybe it is and maybe it isn't, but the fact is that those indicators aren't 100%, and so until I get that calf out, I cannot make a final diagnosis if it's alive or dead.
It doesn't matter that time.
Okay? You got to get it out. So, which is the other part of this, as a producer, you need to be prepared to make a decision. Is the cow more important or is the calf more important? Okay? Because if that cow is more important, I'm going to take that calf out in pieces, right? Because if I can get that calf out the back end, whether it's in pieces or whole or whatever, it's going to salvage the cow, and the cow is going to do better. Because the second I put a hole in her side, she has a hard time recovering. Breed back rates aren't great. The chance of adhesion and other complications further down the road go way up. So if that cow is more important, I'm going to sacrifice that calf to bring it out in pieces in the back end. Okay? Versus, if this calf is more important, say she's a recip cow carrying a high dollar embryo, I'm going to go straight to C-section. Because at that point, that is how I'm going to salvage that calf. Me getting that calf out of this environment as quickly as possible is what's best for the calf. So, that's where part of trying to figure out is the calf alive or dead comes into play, right? Because if the calf is still alive, now it's a tough decision. Is it cow or is it calf? Which is it? Back and forth. But if the calf is already dead, the decision gets pretty easy at that point, right?
I know there's a lot of variables, but travel time, et cetera, but What would your cost be so you can make that economic decision between cow and calf?
So the question is about economic decisions. So I can tell you, and it's been a while since I've actually billed for any of these, so I'm not 100% sure what the going rate is, but a C-section is going to run you probably anywhere from $300 to $500, depending on if you brought her in or if we're doing it on farm and who the veterinarian is and all those other factors. A fetotomy is probably going to run you $150 to $200. Yep, that's where you take them out in pieces. But the fetotomy, depending on how that veterinarian bills, the more complicated it is, the more time it takes, the more expensive it's going to be, right? So there's a couple different billing methods that you can go about it when we do dystocias. First method is that we bill strictly on time. So we pull up to your farm, we start a timer, however long it takes us to get all of that done and back in our truck, stop the timer, bill you for whatever time we were there, right? Usually that means the more challenging dystocias are going to be more expensive because we spend more time there. The other billing system is essentially grade the dystocias, right? Is it an easy, is it a medium, is it a hard, is it a fetotomy, is it a C-section? And then bill you based on the grade, and those are flat rates, okay? When I worked at Iowa State University, we billed them on a flat rate because we had students, and they were teaching opportunities, so everything took 10 times longer than it should, right? I can do a C-section start to finish in under 2 hours. If I do it with a student, it's probably going to take me 3 to 4. Okay? And it's because it's a learning experience, right? They got to know how to handle their needles and handle the tissue and what's sewn to what, and it just takes time. So it just depends on your vet and the situation. So at that point, you can work out your economics, right? Is this cow worth it? Is that calf worth it? And make a decision. Because the other option that nobody really likes is to just cut your losses and euthanize her. And that's usually where we end up on the feed yard. Okay? Feeder heifers trying to calve don't end up well at all. And so when we usually don't find them early, we find them 3 days later. By that point, the calf is dead, rotten, falling apart, sloughing. She is sick, she's down, she's tore up. Cut your losses and move on, right? We just euthanize the whole group and be done with it and walk away, okay? And all of that is an economic decision that you got to make sure, you got to make about your operation, okay? I can help you make that decision, okay? I can help you, tell you the price, tell you what it's going to cost, but I don't know the value of your cows, okay? I don't know if she's going to breed back, right? But I can help you answer those questions so that you can make an economic decision about it.
These don't always come about as picking wrong. You gave the bull for the cow. It could be just, everything's right except the calf. You just have normal position.
Correct. So the question is, how do we get dystocias? Dystocias usually come in a couple of different flavors, but usually the biggest is what we call fetal-maternal mismatch, meaning the calf is too big for the cow, and that causes the #1 problem. Now, does it mean that it's going to have to come out the side? No. It just means that we're going to have to work a little harder to reposition because that calf did not have enough space in the womb to get into the proper position to be delivered. And so, yes, dystocias can be linked back to the size of the calf, but there are other factors, right? Just, did she calve early and the calf wasn't in the right position? Was it, is it a malformed calf? That's the other one. I've had calves that had 2-headed calves. I've had ones with extra legs. I've had spina bifida calves where the back legs are all crippled up. So in those cases, we usually end up doing fetotomies just because the calf is abnormal, right?
How much value do you put in pelvic measurements of heifers?
So pelvic measuring heifers, the value that I put on pelvic measuring heifers is pretty decent. So we do know that yearling pelvic measures and 2-year-old pelvic measures track simultaneously. So yes, measuring at yearling is a good idea. But here's the thing with pelvic measures. Pelvic measurements should be used as a within herd selection criteria, not across herd to herd. So you will run into all these calculations that say, oh, if she's this tall by this wide, she can have this size calf. That's not true. Because when you do a pelvic measure, she's still got a lot of growing to do, right? And so it depends a little bit on your operation, how much she has grown and how much she's going to grow, right? Where's her nutritional plane at? What's her genetic potential? All those other factors. So what I do with pelvic heifers, or pelvic measures, is that we do all of the heifers, and we cull the bottom 10%. So it may be, the size of those pelvises may be something that you kept last year. But according to this year, they're the smallest and they need to go. The other thing to remember about pelvic measuring is that pelvic area correlates to size of the cow. So if you are constantly picking the top 10% or top 20% or top 50%, you're going to push the frame shift of your cow, and she's going to have a bigger calf. Because everybody loves to blame the bull when the calf is too big, but that baby is 50% its mama. Okay? So if mama is a big framey cow, then she's probably going to have a big framey calf. Okay? Whether she can or not, that's what the genetic potential is that she's putting into that calf. Okay, what other question? Where are we at on time, by the way? 4:38. Yeah. I don't know. Questions, comments, concerns, anything else?
So are you saying that if you keep getting bigger and bigger pelvises, that they're probably going to have bigger calves?
Correct. So pelvic area is correlated to the size of the calf. So which is why I don't try to select for the top end of pelvic measures. I use them to cut off the bottom end. So then you've got all of those ones that are kind of in the middle that are average, that are going to have a good pelvic, but maybe not push that calf weight so high.
If you're buying and they provide the information, use that as a factor for purchasing.
You can, but it has to be kind of within perspective, right? So relatively speaking, you know, those pelvic measures are great, but what did everybody measure at, right? So you're usually looking at a heifer. This is her pelvic measurements. That's kind of an island of data, and an island of data doesn't get me anywhere. I need to see what ocean it's sitting in.
There's only about 2 breeders in the system that do a Beefmaster anyway, specifically.
Yeah.
So it's not widely accepted. And in my area, I'm not a high county. There's no vets that even know what they are, so it's how to do it.
Right. And so I try to teach my students to do it, because the other thing with pelvic measuring is to also teach them how to repro track score, right? So feel the size, the consistency, tone, shape of the uterus, along with the structures on the ovaries to determine how close that heifer is to cycling. So that is going to help with your breeding factor, okay? How many of your heifers are going to stick is going to be highly dependent on how big their repro track scores are, right? So we score on a scale of 1 to 5. 5 means that she is cycling already. 1 means that she's never going to, right? 3s are on the verge. 4s are maybe 1 cycle in, okay? And 2s and 1s are questionable if they ever will. So that's the other thing to kind of sort out your heifers. It's another data point, okay? I talk with my students a lot about collecting the data to use it to help the producers, because a lot of this data isn't being collected. It is out there. It is useful if you know how to analyze it and interpret it, and it can help you get to where you want to go in your production. We just got to collect it, analyze it, and interpret it properly. Right? And it's all data points. You can collect a whole lot of data points. You can collect size, frame score, hip height, all of those other data points. Right? You can collect all those data points, but if you're not going to use that information, there's no sense in collecting it, right? Because that's the other thing I tell my students: don't collect the data unless you have a plan for it, because then you're just going to slow a process down and you're going to make your producer angry. But we can do a lot with it, and it can be very useful and very productive if you're willing to work with your vet and collect it. I get that some vets are maybe a little hard-pressed on analyzing numbers, but as a teacher, that's what I'm trying to get my students to do, right?
Do you see the IVF embryos being bigger on a common basis over conventional embryos? Because I have seen them go way past, like 5 weeks one time.
Yeah, so the question is about IVF embryos, if they are consistently bigger or if they have issues with gestational length. The answer is yes. So IVF starts in a petri dish, and that media that egg is growing in prior to you put it into the cow has huge impacts on how that calf grows and develops and stays in the cow. So I was working with a dairy operation that they were doing all of their own IVF, and they were set up their own IVF lab, and their veterinarian was still trying to figure out the media. And so every now and then, they'd get these cows that were 300 days in calf and not having any signs that they were going to calve. And they would get missed because they're large dairies, right? And so they miss that they're just standing in the close-up pen and not calving out. And it's because of the IVF media. whatever it is. They changed the media, they shifted something in it, they changed the recipe, and it changed the gestational length. It changed how big that calf grew. It changed how big the navel is, because we also see huge navels on those IVF calves, a lot of times that they need to be removed, and all of that is based on the media that those eggs are grown in. So yes, we do see more issues with IVF calves than we do with traditional flush embryos. Because a traditional flush embryo, it is fertilized in that cow, you bring it out, you put it in a straw, you put it in another cow, and so there's no media that really has a big impact on it. But yes, IVF does carry some other problems.
With that, do you have a preference or recommendation?
For? So my preference or recommendation with conventional versus IVF, no. I just need to know. I need to know if it's an IVF embryo. I need to know if it's a conventional embryo. I need to know if she's AI'd or bull-bred, because all of that tells me a little bit about what I'm going to get myself into when it comes into that cow, right? Because if she's bull-bred, I know that calf probably doesn't have as high a value if you did an IVF embryo, right? And so it gives me an indicator as to where the value of that calf is at, and also kind of some of the problems I may be running into, right? So the more information that you can give me about what's going on, the better result I can usually get for you. What else? You're getting all sorts of free vet advice here, right? I charge $175 an hour for consulting, all right? Who's paying the bill here?
You make like a fortune.
I know, I'll be collecting on the way out.
The way you make this transition over to Chihuahuas.
Do I make this transition into Chihuahuas? I don't mess with Chihuahuas. I haven't touched a dog in 7 years. Actually, I would rather get kicked by a cow than bit by a Chihuahua. 110%. Any day of the week. I'd rather take a hoof to the kneecap. Yeah. So I mean, that raises a good point. It raises a good question that a lot of people ask me about is, where are the large animal vets going, right? And it's, oh, well, they got kicked and they went to small animal medicine. We don't know actually where they're going. So Tech opened up with a specific mission to create rural practitioners. A&M started their 2+2 program with WT with the exact same mission, to create more rural practitioners. I work for WT, I'm a part of that mission, and yes, I believe in it. Here's the truth though. We dove face first, Tech and A&M, into a solution to a problem that we haven't thoroughly defined. We don't know where the rural animal practitioners are going. Right? We don't know how long they're staying. We don't know how many are going in and how many are leaving, or where they're going or when they leave. So I have a little harebrained idea to do a survey study to try and track and collect that data, right? So the American Association of Bovine Practitioners realizes that their membership is falling off. They know that, right? We know that women are 80% of all veterinary students. No. So the 80% women in vet school is reflective of the application pool. 80% of the applicants to vet school are women. Okay? Now, why is that? We're not 100% sure, right? But that's just where it is, and it's been that way for probably better than a decade, okay? And it's not going anywhere. It's now stable, and it's not going to change. So, vet school is 80% women. The veterinary workforce is over 50% women. Yet, less than a third of all large animal veterinarians are women. So here is the truth and the honesty behind it, is that we got to figure out where the women are going. And their priorities are different than their male counterparts. We know that. Families, time off, work-life balance, mental health, not necessarily money.
We have the same problem in medicine.
Right.
We have 60% female and starting at 40% male. By the time they finish residency, 30% of the females will have dropped out of the system. It's political, nobody wants to touch it. NIH did these programs to try to do different things. It hasn't solved the problem. It is a problem.
Yes. And so the problem is that we don't have the data to tell us where they started, where they went, and why they left, right? So AABP, American Association of Bovine Practitioners, they have seen this issue in their membership. They have started with qualitative studies, which means they interviewed a dozen of their membership and former members and are like, oh, these are the commonalities that we see. There is nothing quantitative about somebody figuring out where these vets are going. Because the problem is that us as veterinary schools, we can create programs and create exposure and train our students and show them how great this is, right? And I can tell you for a fact that our partnership with WT is breeding some fantastic looking vet students for large animal. But if they're going into practices that are going to chew them up and spit them out, they're not going to stay. And we have currently done nothing about getting those students to stay in those practices that we put them in.
The thing that I ran into with our regular vet, and he was bringing in these young vets. He had one male vet that after a week walked out and was standing in the parking lot crying, saying he could not handle the stress of, patients coming in, and then he needs to go outside and pull a cat, and then he needs to come back in and see a dog. And it's been, and then another one after a week. I would, if I were his parent, I probably should have sent him through vet school. He quits after a month and goes and sells real estate because he can't deal with it.
Right. So we've seen that. That is not an uncommon pattern. Okay. So vet school, in general, if you look at the way the process is created, current, I think, acceptance rate into vet school is 20 to 25%, right? Meaning we have 3 times as many applicants as what will ever enter anywhere. Statistically speaking, it is easier to get into med school than it is to get into vet school, okay? And it's simply a seats game, right? That's the statistic probability. And application process to deal with the excessive numbers of applications that roll in for the few seats that we have is they currently rely very heavily on GPAs and standardized test scores. And what that does is it selects for a very neurotic type A perfectionist student, right? There are a lot of very fantastic veterinarians that were not the top of their class, okay? I am one of them.
She's making the most money.
Right? I did not get into vet school my first try. I got in off a wait list, okay? Because my GPA wasn't great, my GRE score was a little off, okay? I didn't get into my in-state school because they didn't want me, because I didn't meet their criteria, okay? That doesn't mean they're gonna make bad vets, right? But it was what we had to do to deal with the application pool that we were at. And so as a result, we have seen this shift towards this very type A perfectionistic personality that has a very hard time creating coping mechanisms. Adapting. And so we recognize it, we see it. Mental health is a huge issue, right? And so we have picked these students, we have put them in high pressure environments, we have not given them the coping skills to survive, and then we sit around and scratch our heads and wonder why veterinarians are the most suicidal profession on the face of the planet, okay? Female veterinarians commit suicide at 8 times the national average. Male veterinarians commit suicide at 6 times the national average, okay? It is a legitimate problem, and we know.
The industry is changing too, though. We're starting to see a consolidation of veterinary schools into the almost like it's a portfolio.
Right.
Dr. Warner and Elton told out one of those guys. They come in and they'll hire a vet on a salary and they'll reap all the benefits. They need the company that's the person.
Right. So, and the reason that that has happened, and we're seeing it in small animal as well, is we're seeing this corporate consolidation. And what corporate consolidation does is it helps improve salaries that can be offered, it improves benefits that are offered, and it improves work-life balance because they don't have to be on call as much because they are part of a larger veterinary pool. And as a result, it is a very enticing offer, especially for a new grad who has been preached about work-life balance for the past 4 years of their career, right? Because we push it hard, right? You guys got to protect your mental health, you got to have a work-life balance, you got to do what makes you happy, right? And so as a result, those practices are much more appealing, which is probably the reason why we are having an issue with rural practitioners, is because the rural practices cannot compete with that, okay? You're looking at 2 and 3 doctor practices, which means that veterinarian is going to be on call either every other or every third weekend, and they don't want to do that because they can go to Houston, they can make $120,000 starting out and only work 4 days a week and have no on-call.
And generally doctors don't make the best business people anyway. I mean, because it's a little bit out of
They can be, so again, that is something else that we have tried to teach our students, is the business side of it. But yes, usually veterinarians get very tied up in the medicine and leave the business kind of to the side, which makes some practices fail miserably. The best practices are actually managed by non-veterinarians. right? You bring in somebody with a business major or a marketing major, they know how to make the business run, they know how to make the numbers work, they know how to make their employees happy, and things go a lot smoother. And so as a result, you have started to see that. That is also starting to happen in mixed animal practices. We do have multiple kind of veterinarians that are, or veterinary clinics that are cooperating with each other to try and reduce that on-call load. Personally, that is how I see the future of this playing out, is that we have to figure out some sort of corporate cooperation in rural mixed animal practice if we're going to see it survive. Because where it stands now, it's not gonna, right? Part of that may mean that we've got to move away from a service and skill-based production model, meaning Craig checking your cows and doing C-sections and pulling calves, to a consulting-based model, which means we come out a couple times a year, we help give you all the information necessary for you guys to make smart production decisions and to hopefully help reduce our workload, right? Everybody wins. But the fact is that means that you're going to have to pay $175 an hour to sit and listen to me talk. And sometimes that's a hard pill to swallow, especially for the small producers. And so it's a production issue. We know it. So yes, there are a lot of problems that to be solved. I don't have the answers, I wish I did. But we are trying. And the first step is to collect the data so that we know what exactly we're dealing with. So.
Is there a location that after you leave here, like I didn't film you, that we can go and actually see what you did again? Okay. Oh, okay. We don't need to.
Okay, anything else?
Very good.